Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. Everyone has a personality, but most people don't have a personality disorder. The term disorder is used when there's an enduring pattern in the way people both experience the world and behave toward others in a variety of contexts that leads to recurrent difficulty in relationships, work, and other aspects of functioning. We often use the word narcissistic to describe people who are preoccupied with themselves or have big egos. Narcissistic personality disorder is a psychiatric diagnosis in which a person is found to have an excessive sense of their own importance, specialness, or talents in a way that causes problems in multiple areas of their lives. If people have this disorder, the signs will appear by the time they're young adults. Some well-known signs of this disorder include an overblown sense of self, a sense of entitlement, a willingness to take advantage of others, a lack of concern for other people's feelings. Signs of narcissistic personality disorder may change over a person's lifetime. Recently, researchers have found that narcissistic personality disorder may have two distinct subtypes, the grandiose type and the vulnerable type. People with grandiose narcissism tend to show the well-known signs, an overblown sense of self-importance, entitlement, specialness, or talents. People with vulnerable narcissism will also have some of these symptoms, but they also tend to have lower self-esteem, be more emotionally sensitive, and present with more anxiety and self-doubt. Think of it as an overinflated balloon that can easily burst. If you have narcissistic personality disorder, you'll likely experience difficulties in various aspects of your life. For instance, you may become angry when you don't get special recognition or treatment, belittling other people to make yourself appear superior, having difficulty managing your emotions and behavior, and having secret feelings of insecurity, shame, or a fear of failure. Research suggests that social and biological factors may play a role in narcissistic personality disorder. Some theories suggest that it may be linked to certain early life experiences, such as neglect, excessive criticism, or excessive praise or spoiling by a parent or caregiver. Others suggest that narcissistic personality disorder may be inherited, but research on this is very limited. To be diagnosed with narcissistic personality disorder, you will most likely have shown many visible signs of it since you were a young adult, and the pattern of both thought and behavior has to be long-standing and enduring. A mental health provider can make a diagnosis after a full assessment. All too often, the general public feels free to make this diagnosis casually of public figures whose vanity is obvious. However, for clinicians, there must be evidence of clinically significant distress or impairment in functioning to make the diagnosis. Because the cause of narcissistic personality disorder is unknown, there's no way to prevent the condition. People with narcissistic personality disorder tend not to seek help. When they do, it's usually for symptoms of other mental health problems like depression or drug and alcohol use concerns. Also, therapeutic feedback that they see as an insult to their self-esteem can make it difficult for them to accept and to follow through with treatment. Treatment options include several types of psychotherapies, also called talk therapies. These approaches focus on the person's emotional experience of themselves and others. People with narcissistic personality disorder often like cognitive behavioral therapy, or CBT, because it allows them to increase their self-control. Treatment begins with an assessment by a mental health professional and should include ruling out other mental health conditions. Narcissistic personality disorder can be hard to understand, but with the right information, we can recognize when those in our lives show signs that they need to get help. I'm Dr. David Goldblum. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.